Hi guys, and welcome to another video. In this video, we're going to learn how to perform CPR using an automated external defibrillator. Now, these devices are really helpful when performing CPR. And the cool thing about these devices is that they're pretty common. In most countries, there is a law that these devices, they have to be present in big public places. So, for example, you can usually find these things laying around in little glass cabinets, in malls, in theaters, in football fields, and generally in very big public places. In schools, you can usually find these devices. Now, these devices don't really need any special medical training, okay? You don't need to be a doctor, a paramedic, or even a first responder to use these because they speak to you and they tell you exactly what to do in every step. So all you need to do to be able to use this is to perform chest compressions. Now, the thing about these devices, it's kind of funny, but you have to put this on the bare skin of the patient. So as you can see, he's currently wearing a shirt right now, and we want to make sure that we take it off. In some situations, we will find out that our patient is really hairy, and as funny as it may sound, some of these devices, they come with a razor inside of the pouch that is surrounding it. Actually, why am I talking? I'll show you. So these are usually, they usually come in some sort of pouch that you can open, okay? And they usually come with a razor in one of the pockets in situations like this where our patient is really hairy, okay? Now, that is basically what we want to do. And the thing about these things is that it has a drawing of where we should place every sticker, okay? I hope you can see it, but it has a very clear drawing of where to place the stickers. So using these things is really uncomplicated. These stickers are actually just an example. It's because the stickers that I have connected to the defibrillator are a bit worn out, and you can't really see what is drawn here. Okay, cool. So now let's talk about how to use these. Generally, we would want you to just perform the normal CPR scheme until someone gets us a defibrillator. So we would just do everything the same. We would first take care of our and our patient's safety. Then we would check his responsiveness. Okay. After that, we would call for help. And when we call for help, we will always make sure that we also ask for a defibrillator if that is an option, okay? Because these devices really help to save lives. And then we will start to perform chest compressions. We will start to perform compressions on our patient until the device gets here. Now, if the device arrives, then we should immediately take off the shirt from our patient so we can place the stickers. Now, the next thing that we should want to do is we should take the stickers. We should look at how we should place them by the drawing, and then we should place them in the correct spots. Okay? As you can see, I'll show you. These are the correct spots. You want one here above the heart and one below it, right here. Okay? Now, after you pressed both stickers, you want to make sure that you turn on the device and it will start speaking to you. Now, make sure that while the device is analyzing the rhythm of the patient, you will stop. You will not perform chest compressions because we want to make sure that the device needs to figure out if his heart is beating or not. If you're performing chest compressions, the device will think the heart is beating when it's not. So when it says that it is analyzing rhythm, we do not touch patient, okay? Any other time than that, we want to continue to perform chest compressions unless the device wants to give our patient a shock, okay? So let's see how it sounds like when the device speaks to us.
Analyzing heart rhythm.
Okay, now we don't want to touch while he's there.
Do not touch the patient.
You see? Okay.
Shock advised.
Now, if he said that a shock is advised, we need to tell everyone to clear out.
Of the patient.
Now, while he is charging, we have to
Shock now.
continue to perform
Press
chest
the orange
compressions.
button now.
Now we press the button,
Shock delivered.
and now we continue.
Start CPR.
Okay, and that is basically how we perform CPR using an AED device. So I hope you could hear my voice while it was speaking. What I said was that we want to perform chest compressions while the device is charging. The only two times where we don't want to touch the patient, and we should warn people around us not to touch him as well, is when he's analyzing the rhythm, and also when we are giving the shock. Before we press the shock button, we have to tell everyone to clear away and not touch the patient. Okay? After we gave him a shock, we should continue to perform chest compressions until the device recharges and is ready to give another shock. And then we just continue to perform chest compressions and we shock him. Chest compressions and we shock him. Okay? And that is basically how we perform CPR using an AED. Obviously, if we have another person, he can continue to make sure that the airway stays open while we perform the treatment, except obviously when we are shocking the patient. In that case, no one should touch the patient. Okay? And that is basically it for how to use an AED. I hope you enjoyed the video, and I'll see you in the next one. Bye, guys.